All right, thank you for staying with Daybreak. We're still talking about the state of COVID-19, which is still ravaging the country right now. Dr. Alfred Mutua, Machakos governor, is with me. Dr. James Nyikal, member of parliament for SEM and member of health committee, is also with me. Honorable Wilson Sosion, Secretary General NAT, is still here. And Dr. Chibanzi Mwachonda, Sec-Gen KMPDU, is with us as well. Dr. Mutua, there was a question for you from Dr. Nyikal.
No, you was talking about, let me go back, he's talking about management. And he's talking about whether the national government can really give guidelines. You see, the issue is cultural in this country. I see that Dr. Nyikal is very animated because he's not animated because he's also in the health committee, but he's also a doctor. And I've worked with him as a colleague, and he means well and everything. But we have to admit that in Kenya, we have a problem in terms of enforcing our own directives. The president came up and said, no mask, no service. As county governments, tomorrow, all of us, we've decided we are going to hold meetings with our county commissioners and with that committee that was set up for emergency and start now strictly enforcing the regulations. I don't know that it's a problem in our culture because it's not an issue of just poverty. We have a defiance culture that has developed. Maybe it's an African thing. We saw it in South Africa. We saw it in Nigeria. Let me give you an example. Australia has basically flattened the curve. They report 0 cases, 1 case, 2 cases, 0 cases of every day. A large country with no cases. Why? Because when the countries talked about lockdown, that people stay at home, even the police officers stayed at home. Askari akakaa nyumbani. When people say the curfew is from 7 o'clock, even the cop was at home at 7 o'clock because nobody would dare defy a government directive that says stay at home for your own good. Hapa unasema wewe ongeza bia moja, haka askari akako, wacha nikunye kwanza alafu niende nyumbani. So we've got this culture of defying. This, about a week ago, I went to visit a friend of mine in Nairobi, and he told me come to this restaurant, come club, and I went in. It was about 3 o'clock in the afternoon. And it was packed, people shouting at each other, people sitting like cockroaches next to each other, people drinking, there was no distance spacing, so no social distancing. And I looked at it, and all I could say was that this was a COVID, enhancement zone. And I couldn't even go in, I left. It was dangerous, but Kenyans felt it was okay. And even some of them were there. I heard them talking about their colleague who had died of COVID because of such behavior. So, yes, there's an issue of management in our country. He's talking about money and all those things, but I still cling to my point that management is weak in our country, has always been since independence. That's why we need a fresh start in the way we do things. Yeah. We need a way of good behavior because even the politicians, myself included, ourselves included, have not been behaving appropriately. We need to have a system whereby we respect government directives. I got into a lot of a tiff, I think it was in your show, when I said that if the police cannot enforce, then use the military. Why was I saying that? Because in our country, you find that even some of our policemen, because nowadays they can be tracked if they get M-Pesas, and if you give them cash, they are a bit unworried about it. They even have a pay bill number that goes maybe to their boss and then wanagawana. I mean, that's the level of corruption we're in. And so what I was saying is this: if we really want to stop the spread of COVID, you don't get it by staying at home and watching TV. Ati unaona mtu yuko na COVID, ameongea kwa TV, umepata COVID. COVID is when you get close to people, when you interact, when you do these things. Yes, we have to grow the economy, but let's do it in a proper way. So let's enforce. And you know, one of the red lights is clubbing. Yeah. And I don't have anything against clubbing. I don't have anything against restaurants. I'm a hotel owner. I'm a businessman. You know, I want to make my money also. But we have to have a sense of discipline in our country. Otherwise, we'll not be able to afford it. All right.
Honorable Sosion, who should take responsibility for all this? Where does the buck stop?
Number one, the buck stops with the leadership. Everything is about leadership. Any national culture of any nation is centralized on the leadership. If we look at this, of course, we've talked about Australia, where if it's locked down, it's everyone. So that's the national culture and the national character that has been developed in that country. Not yesterday, but over time. And it would be like that with all the issues, all issues. We saw the wildfires in Australia, and you could see how the country mobilizes itself to manage. But when you are here in Kenya, we have announced certain measures, putting on masks and limitation of crowds, but the same leadership that is announcing the same with the rest of the leadership, we saw the political rallies without masks and even gatherings in churches. As of course, as Mheshimiwa said, it's true, you see it is packed and people don't have masks. In funerals, those protocols were never followed. And in fact, gatherings in the rural communities, how do you expect the ordinary mwananchi, the ordinary folk, to insist on putting on masks, sanitizing, keeping social distance, avoiding crowds, when the very leaders themselves are creating crowds? I think here it's all about leadership. And we've talked about even the issue of money. When money is limited, then you must do what we call choice and prioritize. You cannot have money for everything. But in this circumstance, where we are talking about COVID, we saw mobilization of resources in this country for COVID. It ran into billions. But now, at the end of the day, we are being told that the doctors don't have quality masks. What does it take to have quality masks? Does it need revenue of an economy of 3 years? It doesn't need much. It's some little billions to prioritize and ensure that our men and women are safe. Now, we've also seen reopening of schools, for example, and you are telling parents to look for masks. And you know what parents will do? They will walk to the nearest tailor, get any fabric which looks like a mask, and give it to the children. So that really, are we serious? Number one, we lack leadership, we lack seriousness. And this one will be embedded in the citizens. And once it is in the citizens, we'll have a national character of a defiant society. And when you have a defiant society, these protocols will be difficult to follow. The police had it very rough, enforcing even the curfew measures at the start of the curfew. And you see, right now, when you look at Trump and now the current president, Joe Biden, has said science will lead the nation in the management of COVID.
Well, let me jump in about...
But now when we're here in Kenya, are we really allowing science to lead the way? Now the doctors are dying out of careless policies. And we talk of no money. We don't have money for insurance cover. Look at the overhead spending of NHIF and the money that we pumped in to NHIF. The other day, the rates were revised. But still, we are talking of the money we cannot afford. But look at the tender system, look at the cartels. The other big problem in this country is that we've become very serious country of entrepreneurs, and we've developed cartels. Entrepreneurs. In every disaster, it's a moment of business. And that's why when we talk of COVID billionaires, indeed, it is real. So if we have cartels, and for these cartels to make money, spend less. And the aspects of quality, even of masks, we are being told. Because if we are to have, to control the spread from person to person, then you must have quality mask. It's not just mask. So really, we are a disorganized country, compromised by corruption, compromised by poor leadership, and a culture of defiance that is fast growing. And really, by the end of the day, as days goes by, we are neglecting doctors, we are neglecting science, we are neglecting facts. And, and when you looked at, when the president relaxed the measures, you looked at the social media, it was all about freedom coming. And that freedom coming, people went to the bars. And they enjoyed themselves. Now we have a wave.
Let me bring in Dr. Mwachonda on this. Dr. Mwachonda, you know, we mentioned it's 13 days to the strike. Speak to me about the state of mind of the medics even right now, because it's one thing to wait for the 6th of December. It's a whole new other thing for them to hang in there for the next 13 days. What are they telling you, the people you speak to on the ground?
Thank you, Trevor. I think before I answer your question, I'd like to agree with what Honorable Sosion has said. And I heard the governor speak here, and I'll say this, Trevor. When it comes to PPEs that are stuck in KEMSA, you know, it is the leadership that was entrusted with the millions and billions that had been mobilized as part of the COVID-19 response that resulted in what we're seeing now, that PPEs are not on the ground. It was not out of the doing of the healthcare workers who equally just wanted protection. Secondly, the issue of money. We still have counties that have received part of the 5 billion grant and are yet to spend these monies in COVID response. In fact, some of the counties have diverted these resources to building schools, building markets. So it's not an issue of money here, Trevor. It's an issue of priority, and we need to make that priority serious. Now, the doctor, I heard the governor say that doctors come, do rounds, and go. You know, there are certain absences that that most of the leadership is making that is fueling the fire on the state of mind of the doctors and other healthcare workers. I can tell you for a fact, and in answering your question, Trevor, that out of the frustration for the last 8 months, I've told you before, financial strain of delayed salaries, the issue of non-remittance of your NHIF, and you have a sick child who is sick and you have to pay out of pocket, then the issue of going to work and every day anticipating your colleagues are dying, this has caused some serious strain. Doctors are frustrated and will not take certain issues that we do not have money, because we did not misappropriate that money. We did not lead to a situation where the basic things that we catered for are not being catered for. I mean, you're in a war situation, you've sent soldiers on the front line, and then you do not take care of these soldiers. You expect them to be patriotic. Trevor, no, that's not going to happen.
In fact, speaking of patriotism, there's someone who's asking that question again, and we've handled this with you, Mwachonda. He's saying, this is Engineer Lazaro Kanyambok, who says, I'm talking to Sosion and Mwachonda as a disgruntled member of the public. Please, please, we are pleading for patriotism amongst you. This should be the time for an amicable solution, not strike threats. Health should be a national issue.
I would like to come in on that.
Yes.
Dr. If you allow.
Yes, go ahead.
I would like to come in on that, even before Dr. Mwachonda answers. I said patriotism is not committing suicide. At this point, we have 13 days to solve the strike issue. Why are people appealing to the doctors and not appealing to the government to act in those 13 days? If all the doctors become patriotic and they go to work and they die, where will that patriotism help us? Please, let the government come up, listen to the health workers, and try to solve their problems with the little funds they have. When you have little money, you do good management, starting with priority. You don't buy PPEs that have not been tested. So, doctors are all patriotic. Most doctors are not even the richest people in this country. Health workers are not the richest people in this country. They work hard. They are only asking to be compensated for the risk they are taking, for their health to be looked after.
Okay.
Why can't we be patriotic? If you want to be patriotic to the country, be patriotic to the people who look after the people. Okay. In a household, you cannot mistreat your ayah or babysitter and then expect that the baby will be taken care of. I cry for health workers, not because they're special, but because they look after Kenyans. You ignore them, you ignore Kenyans.
Okay.
Let me jump into this.
Patriotism is not suicide.
All right, Dr. Nyikal, yes.
Let me jump. You know, that's the person who is asking that question.
Engineer Lazaro.
Is asking a very pertinent question.
Yeah.
Because we're in a health crisis here. And the doctors, the nurses are on the front line. I'm a very big supporter of healthcare workers myself. I'm the person who said, let us pay them extra allowances. At the Council of Governors, we've said we need about maybe 4 billion. Council governors will fork out 2 billion. The national government forks 2 billion. We need to really compensate our health workers. But we also have to also play our role as citizens, that we don't take advantage of a crisis, because we all live in this society. The problem is not just the government. The problem is our society, as Mheshimiwa Sosion has said. We don't just call for a strike and people stay home and people die. We also have to have a sense of responsibility. And let's look at it this way. You know, we're talking about doctors. I respect doctors. We've got about 2,700 registered doctors in this country. But we've got about 16,500 nurses. who are also part of the healthcare system. So it's not just an issue of doctors who are dying also. Nurses are also dying. Other health workers are dying. No health worker should die. So if the doctors go on strike, then the nurses go on strike, then what happens in this country? Because we have to have what you call minimum standards. And so the doctors should not call a strike over minimum standards. You know what I mean? They should say, ikifika hapa, ndio strike inagongwa. I mean, I looked, we've got close to 40 doctors have died in the UK. In the United Kingdom, 40 doctors, actually frontline doctors, have died in the UK. In Kenya, it's 24. You look at the doctors who've died in Nigeria, look at doctors who've died in South Africa. More doctors have died in many countries than Kenya, but you've not heard of a strike being called in the UK. You've not heard of a strike being called in other places. So I understand the frustration of doctors because of the other issues, remittance of payment late, the lack of insurance and others, but also tuwe na utu. Kwa kusema ya kwamba kuna shida, and let's sit down. And so this culture of every single time there's a small problem, you want to call a strike, and you're not even calling a strike about that particular issue of PPEs, you're calling a strike over many other issues, then it's another, what you're calling another Kenyan culture. So it's what I would call, and I know doctors are going to hate me for this, it's a form of blackmail at this particular time. I mean, they won't like this, but it's a form of blackmail. And I understand, no doctor should die. No nurse should die, no health worker should die. We need to pay them on time. We have to play our role as leaders and give them the proper working conditions.
Yeah.
But I would not advocate for anybody to go on strike and people die, because you go on strike, it's your wife who's going to die next, it's your mother who's going to die next, it's your brother, it's your cousin, because it is not the fault of the normal Mwananchi walking in the streets that you don't have your salary. You know, interact with us, the leadership class. Let us get our act together too. But when you go on strike, you are killing the Mwananchi wa kawaida who is down there, who is depending on you, who educated you, who prayed for you in church so that you could go to medical school, so you could become a nurse, and then you go on strike, then they die. So we have to have a sense of responsibility and patriotism where you don't call a strike. We have, how many doctors have died in the US? They're not calling strikes. So this culture of calling strikes all the time, I know pengine wamesikia wamefinywa kwa kona, but it is a culture also that we have in this country that also needs to be managed.
Honorable Sosion, hold on. Let me bring in, hold on just 1 second. Let me bring in Mwachonda on this issue. Mwachonda, are you blackmailing the state?
Trevor, the people blackmailing us are the leaders of this country, including the governor who is there. And let me say this, Trevor. We issued memoranda, we gave our recommendations to the 5th Extraordinary Summit. That was on the 24th of July, held on the 26th, 27th of July. In that memorandum, there was a recommendation to scale down political activity because it was a super spreader event. What did we see in the month of August, September, and October? The super spreader events, the heightened political activity, is what has led to the situation we are currently in. I've heard him talk about strikes. Doctors in South Korea, doctors in Nigeria that he mentioned, doctors in the US, some of the states, doctors in Spain where they were hardly hit, got to a point that they had to undertake strike action because the governments were not coming up to forth in making sure that they were protected. So the issue of responsibility here, Trevor, we all have a responsibility, yes. And that is why our doctors still today are giving services to Kenyans as we speak. But what is the responsibility of county governments? What is the responsibility of the national government? The responsibility is to make sure that our welfare is well handled. But we are not the ones who started the corruption that we saw in COVID. I mean, for all goodness sakes, Trevor, during a pandemic, we have entrepreneurs taking advantage. So these are the people who should be held responsible. They took an oath, we took an oath. So our role is simple. We go to work every single day, present ourselves, be given the gear, pay us on time, ensure that you create a proper environment to boost our morale to be able to serve Kenyans. But if you abdicate that responsibility and then come and say that we are not being patriotic, we are being irresponsible, Trevor, that is blackmail by the leadership of this country.
No, but you know, it's an issue of, you see, even in this, no, let me respond to this blackmail thing. Even there's something called ghost law. So in the other countries, they don't go on strike. I've been following this. In South Korea, they do what is called a ghost law. You say we are going to work, it's a ghost law. So you don't go directly from 0 to 100. You go from 0 to 10 to 20. You build it up slowly up to the area where you go on strike. But I really understand where he's coming from in terms of getting the services. All I'm saying is, even as we, you know, there comes a time in our country whereby if you're facing a pandemic or you're facing a crisis, where you also say you need to be responsible for each other. If the state has failed you, and state, let's say, has failed, he's talking about county governments and the state has failed you in one way or another, then you don't punish the innocent because this state, which you are part of making, has failed you.
Okay.
So there's a responsibility because we still live in this country. You're not going to extract yourself and live elsewhere.
Okay.
So we're in this together.
All right.
So we sort it out together.
Sion?
Yeah, thank you. I think it's very ironical, hypocritical, and wrong for government to try and prescribe to workers how to undertake their activities, including strikes. It's the press of workers, and they decide through organized channels and with reasons. There are always reasons. And we've talked about lax governance system. And I think here we have leadership in institutions that I would call the Mwinyi type, the sleeping type.
Yeah.
You
And
call them the
even
what?
when they wake up slightly kidogo, the first thing they do is to condemn the workers who have been working all round. And I think this is wrong. When doctors here are talking about poor PPEs, that should concern us. And we've mobilized billions. And what we are seeing are cartels. Should we celebrate and protect the cartels and we stop listening to the doctors say, for example? That would be wrong. And would like to caution, a strike is a right. It's in our constitution. And we don't go for strike to enjoy. We don't enjoy. Let me tell you, a strike is not a wedding for any leader of any union. And we do so with justifications and reasons. And it's always the last resort. The issue here, what is so difficult with dealing with the doctors' issues amicably and effectively? What is so difficult? Because I don't think the doctors are mad men and women. They don't enjoy going on. And they're asking for simple things that are known to us. The PPEs and the allowances, which, look at Kenyatta Hospital. The management released the allowances. But some institution called SRC stopped it. And there was a strike. So I think we have poor coordination and poor governance in this country.
And
that workers bear the brunt.
Where does that come from?
You,
no, let me ask you, where does that come from?
Let me tell you, Alfred, it comes from poor governance.
And where does the poor governance come from?
Demeanor and character of the leadership.
And where do the leaders come from?
Let me leave it there. Once you are given the mandate and you are given the authority, you must rise up to the occasion. When you don't rise to the occasion, you cannot leave the burden to the workers.
I concur.
And that's the truth. Let us all be serious with what we are doing. If workers raise issues or even give you a notice of a strike, a notice of a strike means let us engage. What efforts do you make to ensure you engage? But what we see in this country is that when workers issue notice of a strike, they say, okay, wacha tungoje, watafanya nini? When it gets to the day of the strike, okay, run to the industrial court, criminalize the workers. That is not the right attitude. And in those economies, where there are no strikes in UK and the rest, when they issue notices, meetings are convened and there are candid engagement. We've worked globally, and we know how labor dynamics work. and here, it's just but absolute dictatorship to own how watafanya nini. You see, for example, Trevor, when we talk of this issue of teachers, let me talk about it. Allow me a minute or two. The employer suspends the CBA between NAT and TSC, a CBA that is duly registered in court. And it applies the same CBA to other teachers in the teaching service. That really amounts to discrimination and violation of the same CBA, which is contained in Article 19 of the CBA, Article 16 of the Code of Regulations, the labor laws, which of course are very clear. Equal pay for equal value of work done. But then tell me, an employer that wakes up and issues a circular and suspends a CBA because they've disagreed with the union, with respect to them, to membership. What do you call that? That is actually provocation to strike. Most of these strike actions that we see are actually provoked and caused by the employers. Number two, suspending, like TSC, suspended promotion with respect to members of NAT. If you're a member of NAT, you cannot be promoted. And that is very clear. Of course, these are primitive ways of managing workers.
Okay.
I would call it primitive in the true definition. And then number three, you set aside the code of regulation. That is what TSC has done.
Yeah.
And you are applying what you call career progression guidelines, which is nullified by a court of law. If a court of law nullifies a circular or nullifies a piece of legislation, we have seen some of the legislation which have been assented by the president nullified. They cannot be applied. But this same employer continues applying. I'm demonstrating the type of management that we have in this country, that instead of applying the necessary human resource to work with the workers, reason with the workers, they engage in blackmail. In fact, what workers are facing is utter pure blackmail.
So keeping that in mind, Honorable Sosion, you were
managing
there.
of CBS.
By the way, you were there, the last time you were there with me, you said that teachers are ready to open the schools. Are you changing your mind now?
I'm not changing my mind.
But you've also called for a strike.
We are ready to. When you call for a strike, it means we have issues, in-house issues, housekeeping that we must deal with the employer. Because we cannot allow workers who have been paid salaries and others who have been denied.
All factors held constant. Are we ready to open in January?
If indeed all these issues are sorted out. Of course, we've talked about the issues that we have with the employer, including busting of the union and the argument that a strong union is bad for the country, which is neither here or there. It is also not right.
You haven't answered my question.
Reopening
all factors
of schools,
held constant, are we ready to reopen
that
schools
on putting
in
aside, the question is, has the government provided the PPEs and masks for all the learners? That is a precondition, assuming we are through with our in-house issues with the employer, which must be done. That one, Alfred, let's get down. We must humble ourselves as leadership and even as managers of institutions and know that we are doing this for the country and we are doing this for the children, for the vulnerable population that cannot wait anymore. And Trevor, look at this. We've seen girls, teenage girls and boys disappearing, and they're creating their own life and their own culture and mobilizing funds and designing how to enjoy life and how many days to go and spend in Malindi, awaiting for schools to reopen in January. I still maintain, and we maintain as teachers within the continent and globally, that schools are safer for children. Children have suffered for far too long out there, and they must come back to school. But the precondition of coming back to school in this country are that, one, the employer must engage in proper housekeeping with KNUT, and as fast as possible, because the issues that are sticky, they are solvable, but they are actually infringing on the fundamental human rights of teachers. Number two, the government must avail funding, because all these things about funds. Let's not say there are no funds.
It's about money. It's about money.
Yeah, if as a government you cannot protect your very own children and frontline workers in schools, the teachers, because quite a number of teachers have died for the last 1 month and a week out of COVID. Because one, the government must take over and provide quality masks. Not just masks, to all the learners and teachers. Sanitizers. There must be enough funding to avail sanitizers. There must be enough money to avail water in schools. There must be enough money to avail thermoguns in every school. We also need medical personnel in
And
school.
this will be done within a month, because we only have December.
It has to be done.
Okay.
It is a must do.
Yeah,
Otherwise, if you don't do it,
Yeah.
if that is not done, the schools will become super spreading centers.
Okay. Let me bring Dr. Mutua on this.
I was being a devil's advocate here. And it's good because Honorable Sosion was dozing, but now I think when you talk about strikes and everything, now he's fully awake. Because that's
I was not dosing.
that is his area. No, I'm just joking.
Sleep.
He's a very good friend of mine, so we joke all the time. And he got very animated about strikes because that has been. And what I'm not saying that people should not have a right to go on strike. I'm not saying that people should not have their right to actually put forth their grievances. No. It is very important that you be treated right if you're going to work. That is okay, and I think that's your fundamental
Yes.
right, protected under the Constitution. What I'm saying is this: during a crisis, should we go on strike the same way we go on strike during other days? Or should we suspend some things for the sake of the society? Because at the end of the day, you're not working just for the state.
Yeah.
You're working for the sake of our people. My brother here talked a lot about leadership and failed systems and the SRC and others. And I faced the same branch. I remember when I said that Machakos, I'm going to pay my health workers, and I paid my health workers. I mean, I got a letter. You know, a letter was sent to Council of Governors, copied to me by the SRC. They were not in sync with the reality on the ground. And I said, my health workers are dying. I mean, they're in the front line. Let me compensate them. Let me make work easier for them. I have ensured myself in Machakos that I have enough PPEs. I have bought more PPEs. People are saying, Audit Mutua, why do you have more PPEs than other counties? Because I could foresee where this is going. It's better to be over-prepared than less prepared. Now we are in a better place in Machakos maybe than other places because
Now
of the
that's the
steps,
story we want to hear.
that I took. And others were not able to do it because maybe also the economy and the amount of money that they were receiving, maybe they're not generating enough money as we are doing, etc., etc. But there's a question here that I need to bring to Kenyans. And it's a very serious question. And I said we are going to be talking about this in 50 years unless we change this. And he talked about leadership. But where do the leaders come from? These so-called leaders. You want to say that the leaders who are in position right now are the same leaders who were in position in 1970? No. Or 1968? No. Or 75? No. But the same culture has persisted. The problem may not be the leaders. The problem may be us 190 with the way we choose our leaders. The type of person we assign to be our leader may not be the right person to be leading in this country majority of the time. Not to say all leaders are bad, but we look at the biggest thief who steals is the one and is the one who is promoted to be the thief in chief. You know what I mean? Is promoted to go up. You know, you look at the people who are aspiring, for example, like myself, who are asking to be president in 2022. Are we vetting them? Dr. Nikal had a very good point talking about house help, and I asked myself, we vet our house helps more than we vet our political leaders. If you're told that your house help, or your gardener, has been accused of raping children, has been accused of stealing, would you hire them? No. And if you hired them and they raped your child, who do you blame? You don't blame the house help. You don't blame the gardener who you employed while you knew they are rapists. You blame yourself. So as people in this country of Kenya, we've been hiring leaders who have been basically, quote unquote, raping us every day. They steal from us. They don't care about us. They do things that really show that, they can render you poor and then come and tell you you are poor, I'm going to help you. And they are the ones who have rendered you poor, and they pretend they are part of you. We've got leaders here, and I'm not mentioning names, but we've got leaders here who can afford to go overseas and sit down and eat a piece of steak that costs 5,000 shillings, that is more than the salary of a house help, or salary of a watchman, or salary of a young lady or young man working in a store, and yet they call themselves poor, and they are trying to talk about a generational class. So as a people of this country, we really need to know that the computer Kenya may hang, our Kenyan computer is frozen. We need to start it afresh. We need to reboot it, but we need to reboot it with the right kind of leadership that thinks about growing the economy, that thinks about the discipline that Mwalimu here is talking about, that talks about caring about our people so that our doctors never have to go on strike. So we can discuss these things with them beforehand, but that needs good leadership.
Okay, we're running out of time here, but Dr. Nikal is joining us on phone. Internet connections, that's a bit of issues there. Dr. Nikal, you've interacted with all these people. You've spoken to the doctors in the health committee. You've spoken to the Ministry of Health officials. Where does the buck stop and where do we go from here? Because the question then is, we've spoken about the issues that are there, but what are the solutions? Should we be calling for some resignations from the top leadership? What is the plan going forward, especially for the health committee?
The plan going forward, let me just make two comments before I do that. About the teacher strike, there's something I must say I did hear it being said. The next frontline workers are going to be teachers, particularly teachers who are elderly and those who have underlying factors. Maybe they will not just need masks. They may need another level of protective gear, even if not as as sophisticated as what the health workers do, because they are meeting with the children who carry the disease but may not get sick, and then the spread that will go home. That is something we also need to look at. Two, in any negotiation, I've been a trade unionist, even if not registered as such. If people keep appealing to the workers to go back and don't appeal to the government to act, the moment the workers go back, the government sits on its laurel. And 3 years down the line, the same thing has not been solved. This time, I also would not really want health workers, because nurses have also threatened, even the teachers, all the workers, to go on strike. But the person we appeal to do that is the government, to meet them and at least do the bare minimum, so that by the time we get to the date they've said, something has been done. Put pressure on the government also. Now you come back, who does the buck stop with? I said in the health committee, I've been in this game 1981, 1995, and in this one now, the buck stops with the president and the people around him. Some will be official government officers like ministers and so on. Some may not be official government. Some may be the people he listens to. When there is pressure from there that things should be achieved, it will be achieved.
Yeah.
In the health committee, we support that there should be some funding, but there should be better management.
Okay.
Now, there should be more adherence to the guidelines.
Okay.
The simple guidelines. Well, Governor Mutua told you that he saw a bar full. You know, I thought he should have cried when he saw that bar full. He should have called somebody to say this bar should be closed. These simple guidelines we need to do. There was the president's order that NHIF should pay for everybody. Yes, that should be done. But with the structures as it is, if we just take the money and pay all the COVID, NHIF itself may die. So we must look at a way of calculating through actual studies how much money we need to put to NHIF so that it can now take this burden load that has come.
Okay.
Trevor, we sit down at that National Response Committee and we listen to science and take decisions on science and tame business and politics, and let science and professional management take over and guide the government.
All right.
But the leader of that is the president.
All right. Thanks for that, Dr. Nyika. Let me bring in Dr. Chibanzi Mwachonda as we wind up on this. Chibanzi, so where do we go from here now? We're counting down 13 days. Is there any plan for another meeting? I know you mentioned the Monday meeting, but that's behind you now. 13 days into it, is there any schedule for a meeting, or are you just waiting?
Trevor, I'd like to say this, that the way forward is, and let our good friend Governor Mutua hear this, the way forward here is not to say that doctors are not performing at all, doctors are blackmailing us. No, the way forward is focusing on the issues and resolving those issues. Those issues are not impossible issues. Those issues are very straightforward issues that can be resolved if we all sit down and if we all engage in good faith to resolve the matters. It is as simple as that. There are meetings. I will be going back to Parliament this week on Wednesday, and in that meeting, all stakeholders have been brought on board, including the Council of Governors, the Ministry of Health. We shall go and deliberate on the matters. Next week, we're still available. We're still available for consultations, for deliberations in a bid to resolve these issues. Trevor, I think that to me is the focus of both the national and county governments. Do not focus on narratives that will not resolve this. You have a wounded workforce, and that wounded workforce right now is not supported. Then our lives will not be any different from the lives of Kenyans. Perhaps in crisis like this, the worst needs to happen for people who are charged with that everything turn to their.
Okay. Dr. Mutua?
No, you see, let us not be emotional about this. When I talked about blackmail, I'm not attacking any doctor. I'm saying we don't have to get a situation where people feel they're being blackmailed. I'm one of the biggest supporters of healthcare workers in this country. I think more so than many other leaders, and that's on record. I call for the allowances to be paid. I ensure mine in Machakos and my health workers in Machakos, we work very well. I met some of them yesterday and asked them, what is the problem here? And asked them, why are doctors dying more than nurses? Why is it, or is there a perception that doctors are dying more? And some of the nurses were telling me, with the doctors there, that one of the reasons that nurses go for refresher courses where they're supposed to go every 6 months, where they are taught how to protect themselves properly, doctors have not been going for those courses as much as they do. So there are many, many issues here, you're looking at it. So I asked them, because doctors don't spend as much time as nurses do with patients, then why are they more affected than the nurses? So I was getting a lot of questions because I really care about our doctors. But as a society, we look at it this way. There are all these issues, and I want to assure the doctors, we are going to sort it out. I'm one of the ones who are in the front saying, let's make sure the doctors are comfortable so the doctors can get back to work and work well. Let's make sure they are paid well. However, when we look at these issues, let's solve them problem by problem. If the issue of PPEs, let's get the PPEs. If the issue of insurance, let's deal with insurance. But we cannot deal with so many issues during a crisis. Let's look at what are the most important things we need to deal with right now so that the doctors can continue working. So I'm not saying that the doctors shouldn't go on strike per se if they feel aggrieved, but is this the right course at this time when you look at the degree of suffering or where they are? Or is that, because for me, a strike is the last recourse. Today, this morning, after I leave here, we are going for a meeting with the Council of Governors, and together the Minister for Health and the Minister of Finance. And we are discussing the issues that the doctors are bringing up. We are discussing about healthcare. We are discussing about money to counties. We are discussing about averting this strike. So the doctors should know that even as governors, we are at the front line. I'm one of the governors who said we need to have this meeting. I'm at the front line saying let's find a solution. So a solution should be found. So when we say let's not blackmail, let people not get emotional, we are just talking clearly. Let's all think clearly as a country, because when a doctor goes on strike, it is not the government that suffers. It is that innocent person in hospitals gasping for air that is suffering.
Dr. Mutua, I'd like to get your views on one thing. Are we ready to open schools now that you're the governor? Because this is a conversation I'll be having later on tonight. I'd like to hear your views on it.
Yes, I believe that schools need to be open. This is a choice. We look at international standards from Australia, the UK, different African countries, the United States, as
but social distancing has not been achieved yet. There are some schools that are still going to be in tents. Learners are facing a very challenging time.
Being in a tent is actually safer than being inside a building because of the flow of air. So let's not ridicule the tents, because it is actually better to be in an open environment with the children. The problem will be the teachers, as Dr. Nyikal said. Most of the children have and we have also, science has to tell us why. Is it because of the vaccinations? Children are not dying in large numbers or getting very sick. As adults, we need to find out what is protecting the children. So the children will be carriers and they'll pass it on to teachers. So the protocols will be adhered to. We are still a poor economy at the end of the day. But the question is, do you want your children, and my blood crawled yesterday when you heard about these children who are locking themselves in parties with condoms and with alcohol and drugs, because they are bored by being home. Is that a better scenario? Look at the other day we were talking about an explosion of children, girls getting pregnant. This is because our society has not been structured for children to stay home. It's been structured for parents to work and children to be at school. So we have to sort out this problem. And so we have to sort out so that children can be in school in a safe environment. But I think the danger is higher if the children stay at home.
Honorable Sosion, what do you make of this? Are we ready to open schools in January? Because parents are also saying they don't have enough school fees now.
If we live in a laissez-faire system, we will never open schools. The thing is, we must open schools in January. And this is the roadmap from KNUT. One, Teacher Service Commission must ensure that all the teachers, not without exception of any, are happy and ready and prepared to be in school. And what they need to do is very simple. One, reinstate the suspended CBA and pay all the teachers their dues and their salaries. Some have not been paid since July last year when they suspended the CBA. Number two, reinstate all the promotions as provided for in the Code of Regulations for all the teachers without discrimination.
Okay.
And I'm saying this publicly. If they did it, we'll have no problem talking about anything. Number 3, comply with the court orders and stop applying circulars that have been nullified by the court. We must lead by example by respecting the legislation and the laws of this country. Number 4, stop mismanaging the next CBA. We must sit and prepare properly and negotiate in an amicable manner. Number 5, stop busting the union.
What
and
about
selling a
COVID-19
narrative that
protocols in
a
schools?
strong union is bad. And you see, they've been saying, oh, members have left NAT. In July 2019 and August, the Chekhov was reading
protocols?
0. And I'm wondering, did all the teachers over 200,000 apply during that month?
Social
to leave the
distancing
union?
in school is the main concern here.
And of course, we are going for election from 4th of January. It's a democratic right. It's a social right, constitutional right of trade unions. And so
that is clearly stated, but what about this issue of social
that is
distancing
number 1.
in schools?
That is number 1.
Social distancing
in schools. Are you
Social
able to
distancing.
that now?
Social
Then
distancing.
number 2, the preparation for schools. I'm going to the protocols. I'm done with the teachers. That is the in-house. And then school preparation. Number 1, social distancing will not work. We've agreed. That is not working. It has not worked anywhere in the world with the school system. It has not worked. But where classes have been created, fine. Where it is possible to do outdoor learning, fine. Where it cannot work, because sometimes it rains, it's very cold, so you cannot engage in outdoor learning. So the issue of social distancing, let's agree as a country and the world that is not possible to apply in school. So for preparations of schools, then now the buck stops with the government. Because the teachers and learners must be safe. I think all of us, we know that is the recommendation from the World Health Organization. So government must spend, avail resources. Let us not talk of no money. If there was 2 billion for deaths, there should be money for all this implementation of this protocol. Every child must be given a quality masks, availed and procured through schools by the government of Kenya. It's not very expensive. It's 75 shillings for, it's 70 shillings, 2 masks for a period of 4 or 5 months. Number 2, there must be sanitizers, either whether they are soaps or whichever, available in all schools for all our children. And that paid for by the government. Number 3, there must be thermograms to check the temperatures of learners. And number 4, there must be medical personnel, at least 1 or 2 or 3 for secondary schools and boarding schools. We may need more medical personnel.
And this you think we'll achieve within a month? Because we only have December.
And then we have water. And finally, for reopening of schools in January, we want proper certification and approval of every school of readiness by the Ministry of Health. So that school by school, we have its own independent report that they're ready, teachers have been trained, resources have been availed, and masks are ready. If we are not ready, then let us not open. That's a fact.
Gentlemen,
if we are not ready, let us not open. We
you.
must invest, look for money, avail money, and then the teachers must be adequately prepared, motivated, and ready.
We have to leave it there, gentlemen.
I think we are not asking too much.
Thank you so much. Dr. Alfred Mutua, Machakos Governor, Dr. James Nyikal, MP, Semen, Member of Health Committee, Honorable Wilson Sosion, SecGen NAT, and Dr. Chibanzi Mwachonda, SecGen KMPDU. We are counting down the days. We'll see what happens. Let's bring up the feedback if we have the time. Let's run them through real quick. See what we have here. And Philip Koech, I believe, says, Sosion, we request, Session, we request that you convene a meeting. That's Sosion, I believe. Sosion, we request that you convene a meeting for leadership of the 2 unions, Kupet and NAT, discuss the issues together so as to be stronger. Otherwise, the strike you're about to call will fail. Let's see what else. Komen says, let the government be patriotic enough to spend our taxes on the right people, our frontline soldiers. How comes money becomes scarce when required for the right purpose, but is in plenty when tenderpreneurs are to be paid? Governor Mutua is using blackmail language, all right? Jacob Abebere says, point of information about KMPDU strike issues and COVID outbreak. Dr. Mwachonda is justified to go industrial action. Executive and county bosses aren't implementing what they negotiated for. They are adamant. Let's see what else is there. Omoni Dennis says, MPs hike their salaries whenever they want. All I'm saying is review salaries now, make it standard, give necessary allowances as required. Let those leaders implement what medics need because it's theirs. All right, let's see what else you're saying here. Abbas DJ says, listen, I've got family, friends who are doctors and nurses who've got families back home. So yes, I agree with Mwachonda. Let the government be patriotic and provide them with what they need. That's where we leave it for now. My name is Trevor Mbija. We'll see you again at 9 with the latest in just a bit.